Hi, today let's talk about teething. Babies can get teeth at any point, certainly up to even 18 months for their first tooth. And sometimes babies are even born with a tooth. But if your baby seems really uncomfortable, if they're having spells of crying, if they're rubbing their gums with their hand, and if they just generally seem not themselves, they could be starting to show signs of teething. Now, some babies will teeth and you won't see any signs at all. Just one day you'll notice there's a little pearly white sticking out. But if your baby is uncomfortable and you want to help make them feel better, there are a few things that you can do. The best thing that I've found is actually taking a washcloth, wet it, and put it in the freezer. And what happens is it gets a little, crunchy and very cold, and babies like to gnaw on that. So, certainly that can really help. Any kind of teething toy where they can really gnaw and rub their gums can make them feel better. Anything cold can make them feel better. What you really want to avoid, though, is something that we always used in the past, I'm sure all the grandmothers remember, and that's using something like baby Orajel. It does numb the gum, but the concern is if you use too much, it can actually numb the gag reflex as well, and babies can choke. So you really don't want to do that. So basically, cold is your best friend, and if babies are really miserable and it's very clear that they're teething, you might want to try some Tylenol, but I wouldn't do it without talking to your pediatrician first to get the right dose for your baby.